right, so everybody's labor and delivery story is unique. Today we're going to spend some time talking about some information to prepare you for your upcoming labor and delivery. During labor, it's important to have a support person with you throughout all the stages of labor, from home to the hospital. Your partner, your spouse, a sibling, a parent, a friend, someone who is going to be able to be with you throughout the entire process of labor and help you stay calm and focused. As you transition to the hospital, nurses will be available to help you during your stay there. Your healthcare provider, whether you've chosen a midwife or an obstetrician, will be there to guide you through delivery. And a doula is somebody that you can hire that's a professionally trained labor coach. They can help you navigate an unmedicated birth with position changes and comfort techniques that can help you get through that process. When we have tension or fear, we experience more pain, and we want to break that cycle. So the person that you choose to be your support person during labor should be able to help you break that cycle. And around this outer circle are things that you can use to help yourself relax during labor, like progressive muscle relaxation, medication, breathing exercise like rhythm pattern breathing. He isn't a magic breath pattern. Whatever breath pattern works for you to help you focus your mind and reduce your stress and tension is the breath pattern that you should use. So as partners, I like to point out that that's something you should be on the lookout for. So if mom during a contraction is holding her breath during the hardest parts, or maybe she's not inhaling, she's only exhaling, she's panting, you want to kind of redirect her breathing. You can even have her follow your breathing. Say, hey, why don't you breathe with me? Inhale, exhale. And that is the easiest breath pattern to follow. A slow inhale and a slow full exhale. You can even count as you inhale and count as you exhale to give your mind an additional thing to focus on. Position changes. So some of you mentioned lower back pain as a problem that you're having right now, and that's really common. The baby's head puts pressure on your tailbone and your lower spine during pregnancy. So there are positions that you can get into to alleviate that pain. Position changes for if you're having hip pain, sitting on a birthing ball and rocking side to side can open your pelvis and give you some relief there too. Massage, which is each woman likes massage differently. Some like a firm massage and some might like just a light stroking, or maybe it's just hand holding. But opening those lines of communication between you and your labor support partner and talking about what you like and what you don't like is important. So I mentioned the use of positioning to help with comfort during labor. This picture here, the support person is providing counter pressure to the lower back. When you're pregnant, your baby's head puts a lot of pressure on your tailbone, which can cause a lot of lower back pain. A positioning that you can use to help alleviate that pain is any position where you hang your belly down below you, like in a hands and knees position or forward leaning position. That takes your baby's head off of your spine and gives you some relief there. Using a birth ball during your pregnancy can help open your hips and pelvis for delivery. You want to inflate your birth ball so that your hips and your knees are even, so that you're at a good supportive angle for your body. You can sit like this while you watch television, while you're working on the computer, and just roll side to side. And during labor, this rhythmic movement will also help provide you some relaxation and comfort, as well as helping to open your pelvis. All right, so as your labor progresses and you transfer to the hospital, when you get there, they are going to take you into a triage room and get a set of vital signs and hook your baby up to an external contraction monitor. So if you've never seen one of these before, they're two elastic belts with a Doppler attached to them. And they center those Dopplers, one where they can find the baby's heart rate, so they'll move that wherever they need to. And the other one is picking up the rate and frequency of your contractions. So they're trying to determine how often you're having contractions and what is baby's heart rate doing in response to those contractions, making sure that baby is handling the stress of labor in a healthy way. As your labor progresses, if you choose to have an epidural for pain relief, your healthcare provider may want to monitor baby on an internal monitoring system. An internal monitor consists of a probe inserted through the dilated cervix into the uterus that is pressure sensitive and picks up your contractions. The heart rate is tracked on a spiral electrode that is inserted underneath the skin of baby's scalp and provides a very accurate up to the second reading of baby's heart rate during labor. As your labor progresses, things can arise that might require a medical intervention. Your healthcare provider may suggest that they need to use Pitocin to strengthen your contractions or establish a more regular pattern and rate with your contractions. Pitocin is a medication that's delivered through your IV. They may suggest rupturing your bag of amniotic waters if that hasn't broke already. This is an acronym that you can use to ask the right questions to your healthcare provider to get the information you need to make the decision that's right for you and your family. In the BRAIN acronym, B stands for benefits. And you want to ask your healthcare provider, what are the benefits of this procedure for you, but also for baby, because you are advocating for two people in this situation. So what are the benefits and what are the risks to you and baby? Are there any alternatives? That's okay to ask your healthcare provider. They should take the time to explain that to you so that you are comfortable making a decision. And then I stands for intuition. I always recommend to families that you feel comfortable with your healthcare provider telling them your feelings on a certain procedure. Let them know if it makes you nervous. Let them know how you're feeling about it, okay? And then N is no or not now. So because it is your body, you do have the right to say no or not now to a certain procedure. Hopefully, if you've established a relationship with your healthcare provider, one where you feel comfortable and trusting in their expertise, and you've got these questions answered, you can come to an agreement about the procedures. So we're going to talk about pain relief options for labor and delivery. So narcotics can be given as an injection or through your IV. They do cross the placental barrier, and so some moms aren't willing to consider those as an option. They are used earlier in your labor to allow them to pass through your system and be out of your system before delivery of the baby. So many women choose to use epidural or spinal anesthesia for pain relief during labor. You can ask for your epidural at any time during your labor, but it's recommended that you wait until your contractions are 4 to 5 minutes apart before you get the epidural, because the epidural can have some effects on the strength and regularity of your contractions. So an epidural is inserted into your lower back. It is inserted below your spinal cord, so there's very little risk of injury to mom. It also does not pass to baby, so that's another reason that it's pretty popular with moms. The area of your lower back is numbed locally with some very small needles before the procedure takes place. It is a sterile procedure, so most healthcare providers will only allow one support person in the room, if any, during the time of the procedure. Moms are asked to sit on the edge of the bed and curl their spine over. What that does is opens up the space in between the vertebrae so that it's easier to access that area. And then the anesthesiologist or nurse anesthetist will insert a larger needle into the epidural space. And once that access is gained, a small hollow catheter is thread through that needle. The needle is removed and the catheter stays in place. The catheter is then taped to your lower back and is connected to a medication pump that will deliver the medication at a set rate. Epidurals do cause you to be numb from below the breastbone down. So after an epidural is inserted, you are required to stay in bed. Some healthcare providers will have a urinary catheter inserted also after an epidural, since you won't be able to get out of bed. And while the epidural keeps you in bed and keeps you from using some of those upright labor positions that are beneficial for helping your labor to progress, there are things that you can still do from that position in bed. You can elevate the head of your bed to a 45-degree angle to kind of allow gravity to bring baby down. You can use a peanut ball in between your knees to keep your pelvis open and rotate from side to side in bed. But epidurals are considered safe for mom and baby, and they are a popular choice. So you may have heard epidural anesthesia and spinal anesthesia used interchangeably, and that's because they do operate in much the same way. The difference is the location in the spinal column where the epidural is inserted. So an epidural is inserted into the epidural space, and a spinal anesthesia is inserted into the spinal space. What are you guys thinking right now? Are you thinking you'd like to try for an unmedicated birth, or are you ready for the epidural the minute you walk in the door of the hospital? Or what are your thoughts on pain relief?
We are definitely planning for an unmedicated natural birth, but being our second child, I think that we both have the understanding that you have to expect the unexpected. So I don't want any healthcare providers to offer me an epidural, but if I need it at any certain point in time and I feel like I can't do it naturally, then I know it's there for me.
So I love that you guys have talked about it ahead of time and that you are going in it with the mindset of being flexible. I would never want somebody who had their mindset on an unmedicated birth to have mom guilt over choosing an epidural in labor for whatever reason they've decided to. Cesarean births are a procedure that was developed to help moms and babies that could not go through labor safely or effectively. Some of those situations are emergency situations, not many. Only 1% of births result in an emergency C-section. C-sections can be planned, known ahead of time, or they can be surprise. So in a C-section, if the mom does not already have an epidural, the epidural would be placed and mom would be taken to the operating room. Usually one support person is allowed to accompany mom into the operating room, and then there'll be several nurses in there, nurses for mom and nurses that are there just for baby. The doctor makes a 4 to 6 inch horizontal incision in the abdomen, just above the pubic bone. After the incision is made, the abdominal muscles are spread manually. They're not cut or damaged in any way. And then another horizontal incision is made into the uterus. The doctor will then guide whatever part of the baby is presenting at that incision. So if your baby is breech, meaning bottom down, or transverse, which is side to side, the doctor will help guide whatever part of the baby is presenting at that incision. After the C-section, all of the internal layers in the uterus and fatty tissues are closed with dissolvable sutures. The whole procedure takes about an hour from the time you're wheeled into the operating room until the time you are brought into the recovery room. A horizontal incision is used most often in the uterus because that allows you the greatest potential for a VBAC, a vaginal birth after cesarean. So that incision provides the most stable scar as it heals to tolerate future pregnancies and vaginal deliveries. If a C-section becomes necessary in your pregnancy or your labor, recovery is going to look a little different for you. So you not only have a newborn to take care of, but you will be recovering from major abdominal surgery yourself. So having extra support at home can be really helpful to you. Having meals prepared ahead of time, having someone to bring the baby to you so that you're not having to get up and down several times, and keeping your pain under control will be really important as you are healing from this surgery so that you can take care of you and baby. I hope this information helps you feel more prepared for your upcoming labor. Next, we're going to get into some more details about your pregnancy, your labor, and your delivery.